Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good evening, everyone. And thank you for inviting me for this, for giving this lecture, which is about the employee health clinic. In this lecture, I will talk mainly about the scope of service about employee health clinic. First of all, just brief introduction that Employee Health Clinic is, as you all know, situated in Family Medicine Department. The service is provided to Prince Sultan Hospital employees and their dependents in the contract. So this is what we can say the inclusion criteria. So this means that everyone outside who are employees outside the Prince Sultan Hospital are not included in the scope of service or target population that can be served through the employee health clinic. For example, we are not serving the airbase employees. We are not serving the Prince Mansour employees or their dependents. We are not serving Al Hada or any other hospital, either military inside Taif or outside Taif, except Prince Sultan Hospital employees and their dependents. Just one remark that employees who are serving as military security personnel in Prince Sultan, but they are related to the airbase, we are serving them. So any employee or any military who is serving inside the hospital facility, they are welcome to be served in the employee health clinic. But at the gate or any other outside the hospital premises, they are not welcome to be seen in employee health clinic. They should be directed to the channel of service, the same like any other civilian that are served in the hospital. The scope of service, first of all, just I'll talk briefly about the scope of services, and I will focus about a few things that are closely related to the ER physicians, because you are acting employee health physicians outside the working hours, the official working hours. So first of all, we'll talk about pre-employment medical checkup and screening. Just in brief, as you all know, that any new employee will be directed first to the recruiting department, signing the contract, and then he will have two papers. If he's expat, if he's not Saudi, he will be given two papers. If Saudi, he will be given one paper. This paper is the same as if it's speech letter directed to the employee health clinic to do the necessary pre-employment examination. I think you all aware that about the process, so I'll not go through it in details because all of you have been through it. But the principle of pre-employment medical checkup, as per the policy, it takes around 2 weeks. 2 weeks for the employee to finish, because there are two PPD readings. The standard is 2 weeks, but in case the first PPD reading is positive, we will not repeat the second one, so it will be shorter than 2 weeks. So for everyone, positive PPD is a bad news, but for the pre-employment, it's a good news because you will finish the paper quicker than usual. The screening, I will not go through details of screening, but definitely this is not of the job of the ER physician to do it outside the working hours, because this is exclusively in the daytime and working hours of 8 to 12, only 8 to 12 every day during the weekdays. The second scope of service is the annual employees health assessment, the recontracting. As you all know, that every year we have to sign a paper for medical examination that needs to be taken from the HR, either Al Hada HR or Prince Sultan HR, and then you will bring it to me, and I'm going to review your medical records. And speaking about medical records, since I think it's almost 2 years now, the MSD or MODHS, they are requesting not to repeat this lapse again. They are not demanding us to repeat the lapse every year. Before, we used to repeat it every year, but now we are doing it only in pre-employment, except if there is any lab that needs to be repeated. For example, a negative antibody titer that need to be repeated after vaccination, we can repeat it in its due date after the vaccination. But apart from this, we don't have to repeat any routine checkup or annual screening, except if there is a need. For example, if there is a needle stick injury or a blood fluid exposure, or risky behavior, for example, like unprotected sexual intercourse at home country, that anyone can self reveal this in confidential environment, we can screen for the potential exposure of any particular bloodborne viruses. Apart from this, we don't have to do it every year. Number three is coordinating the treatment and prevention of occupational illnesses, which is the main purpose why this employee health is established, is to prevent against occupational illnesses. And speaking about occupational illnesses, the most common, of course, as you know, in a hospital, is infection. But there are different other occupational illnesses, like, for example, musculoskeletal injuries, like burnout. Burnout itself can be an occupational illness or occupational hazard. And injuries, exposure to occupational hazards, and also issue, approve, and extend any necessary sick leave or work restriction, and arrange any necessary referrals to specialties. The difference between sick leave and work restriction is that sick leave is uh, mainly a person who cannot work, who cannot work because he is too ill to work. But work restriction is that someone who is not allowed to work, even if he feels that he is fit, that he is well to work, he is not allowed to work. And there's a policy for work restriction that even if the employee think that he is fit to work, he is not allowed to work because there is a risk for harming himself or harming others. Others, of course, the most important customers we are serving, which are patients, and lots of them could be immunocompromised, could be vulnerable to infection. So work restriction mainly is closely related to infection. If a person is infectious and is dealing directly with patients and there's a risk to spread this infection, he must stay home. He cannot come to work except after clearing this particular infection that is no longer infectious. After this, also scope of services, consultations, education about occupational health, promotes staff well-being, creating culture of wellness that supports physical well-being and emotional health. Of course, this statement is mainly from the GCI. That's why we are quoting the same statement. But in bottom line, the nutshell over here that I'm speaking about is that anyone who need a medical consultation is more than welcome to be served in employee health clinic. If he would like to be served via a specialty clinic, he can also direct it to the specialty clinic through employee health. We are respecting the patient autonomy. We are employees, we are healthcare, but we are still patients. So we have the autonomy to choose who the service provider, our service provider. So whoever want to be served by specialty, he can come directly to me. He's not obligated to be served through me, but at least I need to have a clue about what's going on, so that in case this specialty later on uh, give a sick leave or whatsoever, I need to be aware about what exactly the problem before sending the employee for the particular specialty. We will get later on to this point in details. Number five is assessing the need for and administration of required immunization. This according to the antibody status. For example, hepatitis surface antibody. If need necessary immunization, we will give. And of course, this is something routinely we do in the employee health clinic. And also, by the way, we have four categories for employees. We are not treating all employees the same. So for example, if a person work in pharmacy world, he is not obligated to be immune to hepatitis surface antibody. It's optional to take a vaccine. It's not mandatory, but we are taking baseline for everyone. We are taking baseline immunity for everyone to be a record in case there is incidental needle sick injury for whatsoever reason, either inside the hospital or outside the hospital. We need to take a baseline immunization status. But as for the vaccination, nobody is forced to take the vaccination or obligated to take the vaccination except if the area of work is a high risk area. For example, like laboratory, like a nurse dealing with injection, and those are categorized to A, B, C, D. Each employee is categorized to a particular category that recommend the particular immunization that needs to be taken in case the patient is not immune. Number six is coordinating the employee safe return to work after illness or injury. Typically, any employee should come to me after finishing the sick leave because the he could be still unfit to go back to work, or if he think he's fit, he could be eligible for work restriction, for he's still infectious, for example. So it's quite crucial, very important, that any employee who had a sick leave to come to me for clearance the next day. And I highly advocate that you instruct this for all employees who are issuing sick leave during weekdays, weekends especially. Just recommend that they should review the employee health clinic. It's not like something that will be used against the employee to investigate why this sick leave was issued from the start. It's not like this. The main issue is, are you fit right now to go back to work or not? And in many situations, employees came to me that they are still sick. They need to go home to rest, or even if they are well, as they think they are healthy, they are fit to work functionally, but they are restricted to work to deal with patients. And the most common example here is like conjunctivitis, viral conjunctivitis. Those who are dealing with patients should completely stay away of patients. They are not allowed to work, even if simple conjunctivitis cannot interrupt the functionality of the employee. But he's not allowed to deal with patients, either to work in administrative work or stay home until the secretions are dry. Number 7, to establish and maintain accurate and confidential medical records of employees. And this is very important because each employee, he feel that it's very sensitive to talk to his colleagues about his medical illness. And for this, we have established a particular way of documentation that it was not present before, which is to establish a hard copy documentation, which are kept inside a closed safe that nobody is allowed to review or to see. So in EPF, we are not writing, we are not documenting the chronic conditions, or we can say the sensitive information, medical information about employees. We are not writing anymore in the EPF. The EPF, we are only writing the over-the-counter problems that are related to, like, for example, upper respiratory tract, gastroenteritis, just temporary problem that is not related to chronic long-standing illness or affecting the functionality of the employee. We are not writing this anymore. We are writing in a form. It's called occupational risk assessment form, and it's kept in confidential file to the employee. So any employee can feel free to share any information, medical information, that it will be kept confidential. We are not sharing this with anyone, even with the head of department. He's not allowed to know. And the only situation in which the head of department should know about the employee illness is in case uh, the medical condition compromise the patient safety or compromise the employee safety. At this point, the head of department should be shared about this information, and a previous notification, a prior notification to the employee will be established. You have to inform also the employee that you need to know that I need to share this information with your head of department, and we will convince them why. And eventually, I'm sure, inshallah, that everyone will understand that the public interest is more important than the individual interest. The timing of the clinic, as you all know, but not everyone know, that the timing here, we have different timings for different services. The official duty, is everyone knows, is from 8 to 4, but the administrative work is from 8 to 12 only, because we are assigned in family medicine and in quality. I'm working as employee health clinic, as well as smoking cessation clinic, as well as family medicine clinic, as well as quality work. So I have a schedule, and I'm assigned in different areas after 12 p.m. So I'm not available for administrative work except from 8 to 12. However, any consultation can be served either through me, or if I'm busy, someone else will serve the employee from 1 to 4, the medical consultation and body fluids, and of course from 8, so from 8 to 4, medical consultation and body fluid exposure. And outside the working hours and weekends, we count on you guys in ER clinic to do the work of the employee health clinic only in this area, in medical consultation and body fluid exposure, but not in administrative work at all. You are not requested to finish any administrative work. The only exception was the clearance of COVID because of the need to get back to work in weekends. And this was especially during the COVID surge, but recently it's not applicable that much. But clearance from sick leave is not much administrative work rather than a medical consultation. You are assessing the fitness of the employee to get back to work, so we can consider it in this category, medical consultation. As for PPD reading, the PPD reading, we can say testing and followed by reading is in Sundays, Mondays, and Thursday. So in PPD is done in Sundays, Mondays, Thursdays, and it's followed after 48 to 72 hours, depending on the appointment we are going to give to the employee. So for example, if the PPD is done in Sunday, the the purified protein derivative of tuberculosis, as you all know, it's done if it's done in Sunday, after 3 days, Monday, Tuesday, Wednesday. So the reading will be Wednesday. Monday, the reading will be Thursday, and Thursday, the reading will be Sunday. This is served from 8 to 4. So you can come anytime from 8 to 4 to do the testing, the PPD testing, and the reading will be given appointment afterward. And you should stick to the appointment, because if you miss the appointment of reading, unfortunately, you will have to do the test again after 1 week. We cannot rely on a picture of a PPD reading, or we cannot rely on your own reading to yourself, because it's a high skill reading that both me and my nurse Jazel, we are trained in the infection control department in Al-Hada how to read it correctly. So we are reading the end duration, which cannot be measured by picture, and the end duration is it needs to be measured in a standard way that we in employee health clinic are expert in doing it, and we are not given this privilege to anyone, whoever he is, to do this instead of us. So you are most welcome to stick to the appointment of the PPD reading time, not to have to do it again after 1 week, because if you miss the reading, we cannot do another PPD test except after 7 days of the latest PPD test. So it's, of course, time wasting. Following that, some remarks about a consultation form. Consultation form that which is a form that's given from the head of department to the employee to be seen in employee health clinic. This consultation form, any physician consultation needed from specialty or HC, that if any employee need to see a physician, either specialty or employee health clinic, either in Prince Sultan or any other hospital of MODHS, must fill consultation form, either while on duty or off day or vacation, except the ER department visits. So if one colleague is in vacation, he came to me, said, I'm in vacation, I don't have to tell my head of department, I will have to tell him honestly, how would I know? How would I know that you are on vacation? I don't have your rota, I don't have your you don't have documents in your hand, and you are not requested to provide documents for me that you are in vacation or off duty to show me the rota. I don't care about all this. All I need is a signature. In case problems occurred for any reason or any inconvenience occur, I can say that I have accepted this employee based upon this signature. And the signature can be from supervisor, not necessarily to be a director or just a direct supervisor or a senior person who is assigned in this area to give permission for this employee to go. At this point, he can provide the signature. Of course, if the employee came to you in outside working hours, he is welcome to be served without the need to finish this consultation form. Any investigation needed to be done in any hospital. So we are speaking about investigation including a laboratory, including radiological investigation, whatever it is, whatever service, health service needed. Also, you must fill the consultation form and request the investigation via the AHC clinic. We cannot just do labs in ER without reviewing the AHC clinic first. And the AHC clinic is the one going to request those labs if they are required, because they are valuable resources. We cannot just use them only because the employee want to. It has to be a valid medical reason. And if there is no valid medical reason, we can have a discussion and counseling, because this is one of my jobs, to counsel the employee what is needed, what is not needed. I know that all of us are healthcare providers, but not all of us have the same level of information as regards periodic health screening, as regards preventive services, as regards particular illnesses. Even idea, concern, expectation can vary from one person to another. So this all can be solved out in our clinic, to have a discussion, have a consultation, complete confidential environment, and I promise we will reach an agreement. I will not say like, no, not allowed, just go bang your head in a wall. It's never like this. I have to convince him. It's my job to convince the employee about what's right, what's wrong, what's advice, what's not advice, and accordingly, we are going to reach an agreement. We can say consensus about this, whether we agree or not. Non-compliance with the instructions, neither by the employee or his receiver, the physician who is receiving the employee, will subject to disciplinary action. Uh, there is one remark that in case you referred one employee from ER to specialty directly, you are allowed to do this, definitely, because we agreed that outside working hours, you are acting employee health physician as regards medical consultation and body fluid exposure. So you have the right to refer any employee directly to the employee health, to the consult, to specialty, or whatever investigation you want to request. You are allowed to do this as long as you saw the employee outside working hours, outside after 4 o'clock or at weekends. If you do so, you are allowed to request whatever you want. You are allowed to issue whatever sick leave you want. You are allowed to refer to whatever specialty, whatever healthcare service you want. You don't have to take prior permission from the employee health clinic at all. Okay, and whatever happens when I go back to when in the morning in the clinic, whatever decision you have, I will support you in it. I will continue what you have started. If you started something and you ask me to carry on, I will continue. I will happily continue. I will appreciate you covering me during the outside working hours. We will never reach a form of like a disagreement. In fact, I respect, even if I disagree, I will respect whatever you did, because you were acting employee health physician during that time. And the most important is that we should not do this while the employee health clinic is in working hours from 8 to 4. If it's necessarily to see employee during working hours, it should be in case the employee is in really severe condition, like very sick or vomiting or dizziness. At this point, he can definitely go to ER. Even if I'm there, we don't need a consultation form. Definitely, it's emergency issue. And at this point, I just kindly, I need just to be informed that the employee is there, so that later on, if the sick leave come, I will know that this person was in a critical situation, even if the documentation was not complete. Uh, After this, the head of department is not required to be informed about the medical reason for each visit. In the medical consultation, some of the head of departments are asking why you want to be seen in employee health clinic. Just tell him that I'm not required to disclose this information to you. If the problem is infectious disease, then I must tell you. But if not, I'm not required to tell you. I will not, not necessarily that any consultation should come with a sick leave. It's never like this. It's a matter just I need to talk to my physician, to my doctor. I want to talk to him about something. So I'm not required to tell you about everything in my life. This is personal issues. Okay. The administrative reason for HC visit or ER visit outside the working hours doesn't require consultation form. This is also one of the things that need to be coordinated with the head of department without official document. If I want to do recontracting, anyone who are allowed are welcome to come to sign the papers without prior permission from the head of department. He should arrange a friendly way that he will go to process his papers, but I'm not requested to, I will not request a document to come to me, because the papers are already a document. The papers for recontracting are already a document that to seek service from employee health clinic. This is the consultation form, request for consultation. The diagnosis, recommendation are left blank. I'm the one to fill, and I will keep it in the employee record. This paper will not come back again to the head of department. Some of the employees think that so the doctor will write the diagnosis and recommendation and send it to my head of department, so it's not confidential. No, it's never like this. The head of department will never see this paper. I'm the only one who will see it, and usually I leave it. I will write like C occupational risk assessment to avoid duplicate work, and I'm writing the information in the occupational risk form. All the what's required to fill is the employee department and the head of department signature and date, and whether the employee is on duty or not, and date of the consultation, and the working shift in case the employee is at work. Then after this, some points about sick leave. The only area allowed to issue sick leave outside working hours is the ER department. You are the only person who's allowed to give sick leave if it's not working hours. Any sick leave given outside the employee health clinic, ER, or specialty, either Prince Sultan or any other hospital, should include the following: progress note rating by the physician on Wipro, the same day of visit, and the same day of visit should be included in the sick leave. So we cannot write sick leave, like, for example, I will write sick leave at 11 p.m. or 10 p.m. I will write sick leave starting tomorrow. No, as long as we are in the same day, unfortunately, we have to include this day, even if the duty is only a few hours to the next day. The hard copy of the HR form of sick leave should be filled and stamped by the physician. Two original copies both of them should be stamped and signed. Electronic is not required. We are speaking about the program employees. But as for the military employees and MODHS or MSD employees, only electronic sick leave. So if the employee told you that I am military, like medical military, like EMS military or laboratory military, he should tell you that I'm military. You'll just issue fingerprint sick leave, and that's it. He will not even review the employee health clinic for any validation of the sick leave. But also the MSD, by the way, the MSD employee, we have only 6 MSD employees in all the hospital, only 6. Okay, so he will tell you that I'm his MSD employee, so he's not reporting to the HR of Al Hada. He's reporting to Al Riyadh. This one need only electronic sick leave. But as for us, the program, the HR form of sick leave. Employees of MODHS are not allowed to bring sick leave from any other health facility outside MODHS except for emergency reasons. And the sick leave should be presented to HR directly for decision of approval. For example, if someone is too sick to come to Prince Sultan, he went to Ministry of Health, Primary Health Care, and given sick leave in Sihati. He don't have to see me. He just print the Sihati sick leave and give it to the HR, not through the EHC department, the employee health clinic. Any sick leave given from MODHS hospital should be presented to the same day to the employee health clinic for counter approval or disapproval, and it's the sole responsibility of the employee to submit it. Some sick leaves are submitted late, after 2 weeks, after 3 weeks, and it could be invalid sick leave that will be disapproved. It's not my responsibility. It's the responsibility of the employee himself to make sure that the paper will be submitted to the employee health clinic as early as possible. Except if ER visits, we had agreement with the nursing supervisor that she's the one to submit it the next day. Okay, we have also the other possibility, the admission. The main responsible physician in admission is the one giving the sick leave to the employee or to the employee health clinic, or he's going to endorse it to the nurses. But if there is any mistake, the responsible, according to the medical administration, the responsible is the MRP. MRP is the one responsible, not the nurses. If he is going to endorse to them, then this is approved in the medical administration, and there is a memo about this issue that admission sick leave is the MRP responsibility to present it to the EHC clinic, not the employee, because the employee too sick to come to the employee health clinic. He's at home to rest. So, and by the way, the admission sick leave starting from the day of admission until the days after discharge, all of them are included in single sick leave and is presented on the day of discharge to the employee health clinic. Any military employee granted sick leave should be given as electronic, not HR. We mentioned this. Any surgery for employee, a surgery authorization form should be filled and signed prior to the surgery. It's very important because some surgeries are elective. Elective surgery, this is the surgery authorization form. So the elective surgery, for example, someone has sebaceous cyst. This sebaceous cyst is elective. It can be done today, can be done tomorrow, can be done after 2 years. So some employees may play smart that they want to do the sebaceous cyst at the time of shortage of the department. So at this point, he cannot just go to the surgeon and tell him, can you operate me tomorrow? There should be prior permission and approved by the head of department. The head of department should approve that this sick leave, this particular surgery, the condition required surgery, is filled by the surgeon, and the procedure to be informed what kind of procedure, how long has been present, and can it be done conservatively or not? Is there any other solution than the surgery? And how soon is necessary? Is it urgent or can be elective? And estimated post-operative sick leave. So, for example, if the sick leave post-operative days are 10 days, the head of department should know that he should cover the work during those 10 days. So he should sign, and the surgeon should sign, and then the employee health physician should sign, and then the medical department should sign. And this surgery authorization form will be returned back to the employee. The employee will do his surgery after all the signatures are fulfilled, and give it back with the sick leave to the employee health clinic. And I will send this paper along with the sick leave to the Al-Hada, and the Al-Hada will sign by the finance head of patient billing, because some surgeries are not covered in the hospital. The main one is the plastic surgery. Plastic surgery are not covered, so it will be deducted from the service award from the employee himself. And also other operations that are not covered, the dependents which are not in the contracts. So employee and recognized dependents need to fill this form as well. So, for example, one of the colleagues in Prince Sultan, she tried to do Easewell to her mother, but her mother was not in the contract. So we refused to sign because we asked a document from HR for the dependents that are eligible for medical service in Al-Hada. She could not provide this paper. So we refused to sign this authorization form, because even if we signed, later on the patient billing will take this money out of the employee service awards, because it's not eligible dependent to do this operation. This is the sick leave form. Just brief information how to fill it: the employee number, employee department, work extension, medical ID, name, birthday, sex, physician, and the date. We are going to write, for example, 1 day. So if I'm going to write 1 day, today is, if I'm going to give sick leave for today, so I will write 14 till 14, for example, 14 June till 14 June. So I know that this is 24 hours. If I wrote the next day, this is 2 days. That is the second two is the date in which the sick leave ends. So the next day should be the working day. And the total duty hour, in case the patient is working in shift, we can just write this to avoid any confusion or any mistake here. We can write 24 hours or 48 hours, and then the treating physician and the stamp. And don't worry about any mistakes here. I am reviewing all the sick leaves. If there is any mistake, I will send it back to you to correct it. Okay, it should be 2 copies and not 3, only 2 copies. The 2 copies are sent One of them are kept in the patient file, employee file, and the other is sent to personnel in Al-Hada as well as payroll. Only one copy is sent to payroll actually because personnel, the HR department, are requesting a different procedure which is not related to employer clinic because we have not received any official memo addressing this issue, but just to share with you. And since this session is recorded, those regulations are subjected to change. But as I heard that the HR should are requesting the employee to do sick leave request in through Oasis and scan this sick leave and attach it to be approved by the HR. But let me tell you, as of now, as for this moment where I'm talking that the payroll is completely isolated from this procedure. The payroll, the one giving the payment, is completely isolated from the Oasis process in HR. Until now, they are not connected, and we did not receive any official memo about the electronic or any computerized sick leave issuance. So we are still using the hard copy. This hard copy is sent through the courier to the HR department. The payroll is not receiving any sick leave by hand from any employee for Prince Sultan. It has to be endorsed by the courier, the official courier of the hospital. I think I am done. I know it's heavy dose of information. I'm more than happy to receive any questions, and I'm sure that too many information that to absorb all. So I'm more than happy to receive any questions and those extensions of the employee health clinic during work time. Thank you very much.